Welcome to my garden. Thank you so much for listening. I'm so excited. I'm so grateful that I'm able to spend these 10 minutes with you, sharing some of my visions and some of my thoughts. I hope it will benefit some of you. What I want to share with you the next minutes is my vision for an awakened healthcare. This vision has been growing in me for the last more than 10 years. I'm practicing as a medical doctor, and every day I go to work knowing that I want to help as many people as possible, as much as possible. And I find that a revolution of some kind is needed. And I see it's possible. And I also see a few things important that are blocking the way. The most important, and first of all, I want to share with you how I view my role as a general practitioner, as a medical doctor, and how I believe that we can all benefit from knowing what Western medicine is here to do for us and how it's here to help us. And when I say that, you can hear, I don't believe that is the only way, and I don't believe that it can stand alone, but I believe that it has something to offer. To me, of course, it's the scientific way, it's studying how things are interrelated, it is finding diagnosis, it is testing, and it's helping when you know something's wrong or something's hurting. It's a tool for trying to figure out what is exactly the problem. And on top of that, I find Western medicine is definitely what I would prefer if I had an acute, severe illness that I was dying from. And from there, the model has been stretched, and now it's what we all use as our primary health care model. And I'm not sure that's how it's supposed to be in the future. Because how I view what I do every day, I try to help people find diagnosis and to interpret the symptoms of the body. And then I have tools with medicine to relieve symptoms. But very, very often it is not possible for me to find the root cause. And if I can find it, or if I can sense where it is or what it is, I don't have the tools for healing that root cause. And to me, this is very important knowledge. It means that the person in front of me, this is the one who has the answers. And the answers are to be found mainly inside. So my belief in that comes from knowing that every organism is born with a very, very strong direction and will to survive. And this is actually created from our senses, from input both from the exterior and interior, and from this constant a movement towards balance and healing. And if we didn't have that, we wouldn't survive for very long. Cells need that. In cells, it's called homeostasis, always searching for balance within every single cell, and of course within our whole as an energy system. And this is something that we all have inside us. So of course I can help by being a consultant. I can run tests. I can try and point in which direction is the problem. If you need salt, okay, I can prescribe more salt, or you can eat more salt. But salt, for example, the balance of salt is delicately controlled in the body because it's so important. So if you're out of balance with salt, something else might be wrong. Something in the way you treat your body might be off. And it's not for sure that I can tell you what that is, because you have the answers, because you know your life, you know your circumstances. And every time I have a consultation, I try to spend as much time as possible searching for these more fundamental answers. But first of all, what I want to is to find the diagnosis, to find out, is anything wrong, or is it just maybe a sensation? If you're too tired, maybe you don't need to sleep. Maybe you need to create more energy for yourself by doing something, by being out in nature where energy can be created. So in the dream I have, in the vision I have, the healthcare system is a place where you come and you get help finding out, do I have a diagnosis? Is it something severe? Even if it's not severe, is it something that will pass by itself? Or is this a cause of the way I treat my system? And from there, it needs to be a mutual responsibility between the healthcare provider, healthcare professional, and the person in front of him. Finding out, okay, what is it? What is it I do? What is it I eat? What are the stresses in my life? Am I smoking? Is alcohol too much? Do I have relationships that stress me? All of these answers, it won't be in my office. I can't help answering all of this. So this will be the teamwork. But I find it so important that when you use a medical doctor, you know what are the possibilities, what are the tools here, what can I expect from this? And if we start by knowing this, and if we know that there is a responsibility that lies with me, and if you come and you know this, the room that is created between those two persons is so much different. Because then there will be a chance for those two beautiful individuals to find creative solutions, to maybe search in the dark, where can we shed light? What is it that I do that I don't see, and I didn't recognize that was actually a problem, but now I can see something's wrong, and I need to walk the path, and maybe I need to search for more knowledge. And when you meet your healthcare professional with this energy, with, I would say, realistic expectations. I would say with open eyes. You know what is there to be offered, medicine, and that is a good thing. If you're actually struggling with these symptoms in a degree that makes it impossible for you to think and do anything, then you need help. You need help to relieve a little bit of the symptoms so that you can walk the path. But it will be you walking the path because you have the answers inside. Your body, your system will guide you along the way. And your healthcare provider will be on the sideline, offering you tests, helping you to find out, what is my body telling me? Is this dangerous? Or is this a sign of imbalance? And very, very often that is the case. So actually, of course, I believe time is a resource that is very important. And it is too short, most of the contacts I have. But every time I have the chance, I cannot pass this possibility to give the person in front of me an aha moment, to see, oh, maybe I can make a difference. Maybe I can. And of course, I believe this. And I think many of you do and know that this is the truth. So if this resonates with you, if you have any kind of comments, if you want to share your own thoughts, if you want to share how we can change the system so that it won't be you going to the doctor and having to follow their rules, or they have the responsibility for curing you, because it's not how it works. It can't work like that. So it needs to be cooperation, and it needs to be wiser than it is today if we want to actually talk about healing and talk about finding the root cause and healing from there. Thank you so much for joining me.